Some of the biggest stakeholders in New Jersey healthcare are joining the Murphy administration in its fight to improve maternal health outcomes. Today, some of the brightest minds from the Department of Health to our hospitals gathered to discuss the changes needed to be made in the health sector to improve maternal health. Senior correspondent Joanna Gagis was at the conference and spoke to healthcare leaders about their solutions.
There is not one big miracle solution. There just isn't. It would be great if we can say this is the legislation or this is the policy or this is the program that's going to solve everything.
Stephanie Silvera is an epidemiologist at Montclair State University who convened a conference today around maternal health in New Jersey, which still has poor outcomes in many ways.
We need every single person working in an area that they are passionate about to make small changes that add up to big outcomes.
In the room were healthcare providers, nonprofits, and government representatives looking at the issue from all sides. Dr. Becky Ofrane from the New Jersey Department of Health spoke about a few of their recent efforts.
Community doula training in New Jersey, community health workers going into homes, postpartum depression program. We have a new program called ALMA.
This event is the first event for the Public Health Advancement Scholarship and Training Institute that we're launching today. And what we are really hoping is to create opportunities to bring people together to do this community-based work.
I think what we need to do is maybe work outside of our silos. I think we need to look at the environments in which our clients are in, the systems that we have in place to support them.
And find ways to offer more services all in one sitting for new or expecting moms, says Susan Stevenson Martin from Rutgers, New Jersey Medical School.
It might be WIC, it might be low electrical opportunities, rent assistance, which includes housing. It can be childcare. It can be, I need to take my child to the pediatrician.
During the conference, the topic of bias training came up.
So I know that one of the bias trainings that providers have to take was developed at the Department of Health. I've seen the training. It's pretty good.
The state is moving forward with a proposed rule that would require implicit bias training for healthcare providers. That's part of Governor Murphy's attempt to improve maternal outcomes, especially in communities of color.
I think there also needs to be strong examples of role playing and not just having it a computer-based training, but really working through some of those bias and racial and ethnic disparity issues in person with different teams of providers.
One speaker today pointed to other countries the U.S. can learn from who have much more successful maternal and infant outcomes than we do here.
We can learn how other countries have used their health systems in a different way than we are doing in the U.S. to solve things such as labor, breastfeeding, lactation, consultants. It's like best practices around especially the nutrition part, because nutrition, it's actually something that increases the IQ of the kids.
Others looked at issues like teen pregnancy and substance use, the #1 factor contributing to maternal deaths in New Jersey, and not to be forgotten, the role of dads in maternal and infant outcomes.
Giving the men and the father figures, not just biological fathers, but father figures in the community, the resources to protect, provide, and prepare for their families and communities, I think sets us all up for positive, healthy outcomes.
Today's attendees are encouraged to continue collaborating as they carry out their work. In Montclair, I'm Joanna Gagis, NJ Spotlight News.